The daily COVID-19 case count in the country is down to its lowest this year. The health department reported 1,712 cases Sunday, with Metro Manila accounting for 20% of the new infections. The government is ramping up efforts to protect the population from the virus. Starting tomorrow, vaccination at select stations of the LRT2 will open. Take a look at your screens. We are flashing the schedules for the Recto and Antipolo stations. You can get either your first dose or a booster at these sites. You will have to register online first before getting your shots. If you plan to go to the Recto station, register at manilacovid19vaccine.ph. And for those who are heading to the Antipolo station, the website is antipolobantaycovid.appcase.net. And joining us now is Octa Research Fellow, Dr. Guido David. Good morning, Professor. Good to start the week with you, as always. Now, yesterday, we recorded the lowest daily tally this year at 1,712, and we see that there is this regular, continuous decline. Can we expect this downtrend for the rest of the month?
Yes, Ria, we're expecting it, and of course, we're hoping for it. It's not guaranteed, so that's why we still have to comply with minimum public health standards. I mean, I'm speaking for the general public. But the trends are very encouraging. The hospital utilizations continuing to decrease. Right now, we have not, or we do not see an LGU that is still considered at high risk. So all the LGUs are either at moderate risk or lower. In fact, Lucena is already at very low risk, while NCR is still at low risk, but we're expecting it to improve to very low risk sometime in the near future.
All right. Last week, Professor, when we spoke to you, you said that it is entirely possible that cases could go back to the hundreds, back to where it was pre-Omicron surge. Do you think it's possible that this year cases will go down even further and we might be seeing them in just double digits?
Yes, Ria, that's the trajectory. Of course, double digits. I don't think we've seen that except since the very beginning of the pandemic. Right now, the goal is to get it down to about 3 digits in the entire country. This will happen, could happen sometime in March. When it will get down to double digits, we'll just have to see about that. It could take some time. It could happen around April or May. But of course, with the campaign period, it's actually enough if cases are down to about 3 digits. They don't really have to go down to 2 digits, but if they do, that would be great.
Yeah, absolutely. Now, there are talks about the possible shift to alert level 1 by March. Metro Manila mayors are going to meet on that tomorrow. Can we get your thoughts on this? Are we ready for level 1?
Well, I think we're close to it, Ria. The positivity rate in the NCR has decreased to 6%. And the high positivity rate is usually what worries some of the other health experts. So we're projecting that the positivity rate would be down to about 5% sometime this week in the NCR. And when that happens, that should probably be sufficient to get us to alert level 1, if that's the plan of the Metro Manila mayors.
All right. Thank you for your expertise as always. That was Octa Research Fellow Guido David.